Our first panel discussion today is going to be titled Physician as an Innovator, Navigating the Modern Healthcare Business Frontier. And our panelists are going to explore the challenges and opportunities of this dual role. We have got a moderator and 3 panelists, so please welcome to the stage Dr. Ali Tanazli, Dr. Kibet Shikuku, and Dr. Caroline Purvey, as well as Dr. Fahad Attar. Please put your hands together as our first panel is about to start.
Wonderful. Good morning, everybody. We've had a very interesting 2 days here, and moderating this panel, I think, is a pivotal moment. Why? Because on the front cover of this event is innovation. So if we don't take away the golden gems of innovation, and that affects everybody in this room, and anybody that will be listening in the weeks to come from this event, you're all having to think about innovation. We've heard some wonderful gems this week, and what resonates in my mind from yesterday is here and now. You are all here, and you're here to discover something that you can take away to support your work as a practitioner. And it's about being now. And you can't be now if your head's in the phone. You can't be now if you're looking at your laptop. Because then we've missed the moment. So I hope we're going to make this a very lively and innovative panel session. And I'm going to start by asking Dr. Ali to introduce yourself and tell us, remind us, if we didn't hear you speak yesterday, where you're from and what it is you're currently doing.
Hello, good morning, everyone. Great to be part of this panel. My name is Dr. Ali Tanazli. My background actually is a PhD in biophysics. And I actually built in my past new businesses at Sony and HP in the US. That I joined a startup called LifeSpin. Yesterday I introduced LifeSpin. At LifeSpin we are extracting a very exciting layer of information from blood. We are scanning human blood samples in a magnetic field with a method called nuclear magnetic resonance. This method provides us hundreds of metabolites, which can be translated into hundreds of clinical parameters, which then we use as part of our AI engine to build a general health assessment dashboard of the human body, which is being used in checkup medicine. And so basically, the part of innovation here is that you perform the testing basically in silico with algorithms, which is a completely different way how to do it. What excites me most, also with my background from consumer good companies, is that it's truly affordable and has really the potential to reach wide populations.
Thank you, Dr. Ali. Dr. Fahad. Dr. Kibet, sorry.
Yeah, thank you. Mine is Dr. Kibet Shikuku from Kenya, one of the leading countries within the region as far as healthcare is concerned. I happen to be, as medical specialist, I am a hematopathologist by training. But besides that, I've been teaching at the University of Nairobi. For those of you that may have had a chance to visit our country, that is one of the leading institutions, training doctors. And so I happen to have had the opportunity of teaching in this institution for the last 10 years. But besides that, I'm currently supporting a very unique facility as a CEO of our National Spinal Injury Referral Hospital, something that is completely off what I'm used to doing. But then I think that gives me an opportunity to look at things differently. But besides that, I happen to be the deputy director for a private facility, which is the Nairobi West Hospital. A facility that is championing care, moving care to the next level, and trying to change the dynamics around healthcare in Africa. Because I'll tell you, if you move around and see the variations in terms of care, really, those of us that live in this relatively endowed and resourced setups may always imagine that the rest of the world is at par with you until you move to our continent and you can see the level of care and the challenges, surrounding the kind of work that we do. So creativity then becomes extremely essential in the kind of things that we do. And I think we shall be sharing and seeing, how we manage some of the issues that we have on the ground and, apply whatever is possible, within our setups. But again, I look forward to having a good conversation this morning. Thank you.
Thank you very much. And Dr. Farhad Atua.
Yeah, good morning, everyone. Thank you for having me here. So I'm Farhad Atta. I'm an orthopedic surgeon by profession, specializing in sports medicine and sports surgery. And I'm also the CEO and founder of Regenesis Orthobiologics and CEO and co-founder of We Healthify, which is a health tech solutions company. So from a Regenesis Orthobiologics perspective, we've got clinics set up in the UK, which basically look to manage and deal with patients with musculoskeletal problems, so joint pain, joint stiffness, osteoarthritis, sports injuries, where we look to treat them from a very holistic, non-surgical way with a lot of multimodality approach to try and then take them forward to quick, speedy recovery. And we've got clinics set up in the UK, which we're looking to expand, and we're looking to bring that concept here as well to Dubai and to the GCC as a wider sort of margin. We're also involved in a lot of screening programs for patients to find the risk of osteoarthritis, risk of inflammation using biological age, genetic biohacking. And we use this information again for holistic approach to try and get patients to avoid reaching the stage where they need a lot of interventions and treatments for their osteoarthritis management. So overall, from a health tech perspective, we're involved in finding solutions for a lot of hospitals, organizations that can help streamline their services. We have a lot of contacts from a global perspective in this sphere, and a lot of people onboarded with us. And from an innovation perspective, which is quite apt for our sort of platform here today, most of what we are doing and most of what we're all here doing is basically trying to push the frontiers and trying to provide best and improved patient care. Thank you.
Thank you very much. And last but not least, I'm Dr. Caroline Purvey, and I'm from the UK, but I have a global mission. 13 years ago, I discovered something quite empowering and have spent 13 years developing it, working with individuals. Who are my client base? Anyone with a psoas muscle. PSOAS? Look it up, because I doubt you know where it is. You might have an idea where it is, but it's not called the hidden treasure for no good reason. I don't do anything to anybody, but what I do through my expensive and extensive experiences of investing time and funds to discover the power of the human body to heal itself. Please don't be alarmed and think, well, so what are we doing here then? Everything is enhanced when we get, and we've heard it here, when we get to the root cause. And the root cause of trauma can go back to birth. So how do we, as adults, know how to talk about it? If we don't know what the problem is, because it's deep-rooted, but the body knows. And so in brief, I empower people to take responsibility for their well-being. Move away. I don't know what it's like where you're from, but in the UK, we were raised that NHS will fix us if we're not well. Actually, times are changing. And that's what we're here to talk about, changing times. Changing times. Let's take a step back in this discussion. And I'm going to ask Dr. Ali, because this is about, can physicians lead shift towards healthcare models and all that might entail? Well, how do we know what that is if we don't learn from history? And we live in very turbulent, changing times, and we have to keep up with it. Sink or swim, I think they might say. What was life like in your practice, your business of healthcare before COVID? And I think that's an important step back because not that long ago. So, Dr. Ali, if you'd like to share.
But before COVID, I think historically also AI was kind of still future or even science fiction. And it was still about individual IVDs. So I had background in vitro diagnostics industry. It was all one test, one disease, large analyzers. So basically, it was pretty much very traditional. And what I think, and this is correlated also with the fact that you always have to go to a healthcare provider to donate a blood sample, right, to get your blood sample collected. But I think what happened during the pandemic was that people got used now to provide samples, even at very unusual places, like in cinemas. So basically, you got some level of distributed care services during the COVID pandemic because of the testing and the vaccination. So what happened is basically people also on a societal level got more used to get samples collected pretty much everywhere, even in a shopping mall. And this is an important prerequisite because if we now speak about utilization of AI in healthcare, it means also that I should be able to access these new AI tools over the cloud, right? So basically it's all goes towards distributed healthcare services. So basically for distributed healthcare services, you need distributed blood collection or sample collection infrastructures, and also the mindset of doing that. At the same time, you are benefiting from this because distributed care services enabled, powered by AI solutions, lower cost per se. It is much less expensive. It has to be. If not, something is wrong, I would say. So basically, the COVID pandemic was kind of a not so good time, but paved the way, paved the road for distributed care services, in my perspective.
Thank you very much. Let's move it. How was it for you, Dr. Quebec?
Yeah, I think pre-COVID care in my region, was based on, visits to facilities, interacting with the patient. We believe that as a doctor, if you don't touch the patient or if the patient is not touched, they don't feel like they have actually been attended to. And people would go home quite dissatisfied. They would wonder what kind of care and what kind of a doctor you are. But post-COVID, things have changed immensely. The role of telemedicine now has set in. People can converse across boards. People can consult across boards. Care has really changed. I keep saying that we now have two different generations in my setup. We have the older folks and the younger folks. The younger folks have less to do with touch, contact. The older folks are still struggling, to catch up with changes. So I think pre-COVID things were a lot different from what we seem to see. And just to look at one particular scenario, and I guess I'll reverse this back to the AI developers. Pre-COVID, we have had a lot of issues in relation to information acquisition from patients. I happen to interact more with, children, mothers, babies, and a mother presenting, for example, with a child with gastroenteritis, diarrhea and vomiting, would potentially come with dehydration to the hospital. And in my setup, parents tend to use herbs to children. And so mothers have learned that if you asked them whether they had actually used herbs, the next thing is a bash. They would be bashed. The doctor would be quite upset. And so a lot of mothers then would not disclose use of herbs. But remember, if you get a dehydrated child who has used herbs, the type of dehydration is a lot different from one that has not. And so we realized that we were losing every month almost 15 children because of dehydration. And the cause of death was the doctor, not the disease, because our formulations for rehydration were a lot different. And so the question then became, how do we get appropriate and correct information from the mother? We had to use reverse psychology. You accuse the mother for not using traditional herbs, for them to admit that actually we used traditional herbs for you to manage the patient. So my question to the AI developers is the role of reverse psychology in AI use, whether that is a possibility to actually get information that then helps you now that we are transitioning from physical to other forms of interventions.
Thank you. So that's wonderful to know what it was for you before COVID. And so Dr. Farhad Atur.
Sure. So, excuse me. I've had the advantage of working in 3 different countries and 3 healthcare sectors, pre-COVID and post-COVID. So I've done a lot of work in the UK and Saudi Arabia and here in UAE as well. So before COVID, I think most of us were on autopilot, to be honest. So we used to deliver services, we used to deliver patient care without really thinking about most things that have become more relevant since COVID. So most of the practices ran as they did in all countries, but once COVID hit, something significantly changed. And the change was really what COVID did to different populations in different sectors of the world and with different comorbidities and different medical conditions. So people started looking into why people are behaving differently, why their outcome is different, what the impact it's had overall. And hence came a lot of screening, and hence came a lot of blood testing tools. So I think post-COVID, people started looking more from a perspective of healthcare, which we didn't have before the COVID era, if you like. And as you rightly said, COVID was a devastation, but it's made and brought in a lot of different changes from service delivery, as well as from an overall healthcare package for the patients, concentrating more on areas that are more relevant to overall health than disease-specific. Because what we realized is, before COVID, people's disease status was different, their health status was different, and COVID has basically shown a light on how you can optimize those things. Thank you.
Thank you very much. So before COVID, what was I doing? I was seeing people on a one-to-one. I was running workshops up and down the country, and I was witnessing the power of trauma leaving the body. Because when we let the body do the talking and get out of our headspace, miracles can happen. And working alongside other practitioners, therapists, it enhances their work. I'm very conscious that before COVID, I had a huge responsibility, because witnessing trauma leaving the body is powerful. Simple. To activate the psoas. Could get a 10-year-old to show you that. But it's the missing piece of the jigsaw. We have lots of coping mechanisms to manage the impact physically, mentally, emotionally of stress and trauma. We've heard wonderful things from walking in nature, being in nature, breathing, yoga. I've been a yoga teacher for over 30 years. That's the only one thing I do. I gave up all other therapies when I realized the power of the body. But when COVID came, things changed in a way that I never thought was possible. Hold that thought. I'm going back to Dr. Ali. COVID came. What changed? What did you have to do to innovate, to become different and move your practice forward?
So basically, what I've seen and after the COVID pandemic was a contraction in the diagnostics industry, because during COVID, diagnostic testing was at its peak. After COVID, testing became less and less. Even in traditional fields, even checkups became less, right? So basically, this seems to be a great opportunity to basically remodel and basically do it differently, to make testing in a different format, which is more comprehensive. Because what COVID also did, I think, was empowering of patients and consumers to basically take more control over themselves, which is, I think, an important prerequisite, because prevention is driven by self-consciousness. And this, I think, is the key thing, that people really got more self-aware and basically more open, because the average person, I think, is very open to new technologies, even in healthcare. The regulatory bodies not very much, especially not the US FDA, but this will change over time. But it's important to basically, as a sanity check, to see if your thesis works or not, if average people would basically like to do it once it becomes available. That's the key thing. And this awareness is there.
Thank you very much. Interesting time.
Yeah. So I think COVID did quite a bit for us. And I want to approach this conversation from a fraudster's perspective. You know, there's a lot of fraud in the medical world. And we picked this during COVID because what we noted during COVID was the most important result that everyone wanted was a negative result, not a positive result. So everyone was working towards a negative report. You know, you are COVID-free. And I guess majority of us seated here would have wished to see a negative report. And so one thing that we learned during COVID was we had permanent individuals resident within our facility to be tested. So if you needed to hire a subject for your tests to be negative, you know, we had specific individuals that you could easily hire for a negative result. And they were going to be tested for you. So one thing that we had to do, and you know, we've had to apply this, you know, with our current practice within the hospital, is that we had to try and revisit appropriate means of patient identification. And we had then to install 3 different ways of managing and identifying an individual. One was, you know, a unique identifier, which is serially generated using our system in the hospital. The next was we created what we called the eye of the needle. So we created a mechanism that could only allow an individual to pass through, one single individual to pass through a section to be taken a photo. So that simply meant you could not be 2 of you. It could only allow one person to move to the next phase. And that phase required us to take a photo. Okay? So that was our second identifier. But that was not sufficient, because initially, after that step, the next step, which was the most crucial step that required us now to take a sample from you, is where the fraudsters could come in, these tricksters could set in. And so we could only allow that particular individual to move for testing, and that meant we were going to get a specific sample for that specific individual. But that was not sufficient. We generated a QR code to validate the exercise. And so we were able to use 3 different mechanisms to validate one single activity. And that has helped us a lot in minimizing, fraudsters and people who would otherwise take advantage of processes. And we've had to incorporate this in all our service points within the hospital. Because I remember at that time, we flooded Dubai with over 16,000 travelers with COVID. And I think we even ended up having, the government's taking, steps to just curb COVID spread.
Thank you for those insights. Fascinating. So in a way, it slowed everything down, all the processes.
Yeah.
Thank you. Dr. Fahad.
Sure. So I think COVID has actually changed a lot of practices, especially from a healthcare sphere. Before, it was unheard of not seeing patients face to face, and point of delivery and point of care have always been in the clinic, in the outpatients, in the hospitals. So what COVID has really pushed people to do is to innovate on quite a lot of fronts. And as physicians, being put in the seat where things that you're used to doing, you can't do anymore, service you're used to providing, you can't provide anymore, the traditional methods of how you used to see patients, treat patients, that's changing. So it pushes you to try and innovate in ways and areas that you can still, deliver the services that you're used to. And a lot of people realized, a lot of health physicians, surgeons realized that patient care and contact could still continue through telemedicine. So we saw a huge shift in telemedicine consultations, huge shift in services which could be done from home, such as physiotherapy, rehab videos, physiotherapy, rehab, online consultations, which was, again, a big paradigm shift really from what we're all used to, what's outside of our comfort zone. And with that as well came a big shift for people to start educating themselves and educating patients in what's available, what's not available, how you can do things differently. And those were all sort of game changers. And another big focus was data collection, trying to get as much data about your health status, because people started becoming aware. They started looking for areas where they can enhance their health, how they can improve their well-being. And from that perspective, data collection tools became, again, widespread. Now, it's good to have huge amount of data collected, but what you do with the data is most important. So now there's a lot of transformation services and products that are available where you're trying to use a lot of this data from a health status perspective to try and fine-tune patients' well-being, precision health, how they can age healthier, and how they can change their lifestyles. Now, all these things really were not on the forefront before COVID. And I think that's made one big difference because people are a lot more aware of services that are available. They're a lot more aware of differentiators that are available now and how they can get these services. And what's available, we can actually streamline them to enhance and develop more patient care. Yeah.
That's wonderful. So we are seeing a lot of innovation going on through the different practices. What did I do? My son, Daniel, said to me some years previous, "Mom, you want to get your program online?" And I said, never. And I'm a great one that says to people, never say never. And it did. The one time I said it, it came back to bite me because COVID came and it's like, wow, now what are we going to do? Anxiety and depression's going through the roof. They need what we have. And so because of my years of experience working face to face with everyone from cancer, Parkinson's, amputees, heart conditions, brain conditions, stroke, I worked with them all because they'd come to me and say, "Will this work for me? I've tried everything." And I say, "You live in your body, why would it ever take you to a place of harm?" And because of all that experience with Daniel, we worked hard and created a 4-module program that would provide education that in one day in a workshop, they take away in a booklet and they lose their booklet, they've lost it. And so it became a very powerful, innovative time to put a most empowering process together to ensure that wherever in the world somebody would pick the program up, they would feel safe, they would feel supported. And we measured through the forms that they completed where they were at the start and remeasured at the end. And during COVID, I invested in having our data from online clients analysed by a university. Because as much as I could say, oh, this works, that was me. I wanted somebody else to say it worked. And two key findings: physical, mental, emotional well-being improved 99%, and not by chance. High levels of anxiety and depression measured through GAD-7, PHQ-9 from police officers, down over 60%. For laying in their own home, in their own space, in their own time. So for us, it was very, very innovative period. But change has happened. We can't go back. We learned from what we were doing. But change is very difficult for a lot of individuals to swallow, particularly with health, when they're used to that sitting in front and having the time. How have we become innovative since? And where is that taking us now? Dr. Ali?
I think it's important to, when we innovate, to understand the value chain we're innovating in. So in healthcare, the healthcare value chain is quite complex. We have different constituents. You have the patient, you have the payer, which could be the insurance company, or the patient, or the government, depending on the country, or the system. Then you have the physician, you have the lab, you have the hospital, you have pharma, you have retirement homes. So it's crazy, actually. But I think it's important that when you innovate, it should be a tool, first of all, which improves efficiency. So basically, the way how we look at it is, what we are doing is to help the physicians, to help the clinicians to be, let's say, more comprehensive when they check up, when they test patients. So basically, having a tool which can be used on every patient, just like a stethoscope, but basically enhanced with an AI system which goes deep into the different layers of health which we have. So, but then again, the question then is, why should a physician use it? Even if they think it's useful, in order to implement it, they also need resources in their own practices. That means, how can I incentivize the physician? So basically, when someone develops a new lab test, right, then the physician's incentive is zero, because they just get $5 for the blood collection, and that's it. So basically, how to make the physician part of it. Now, when you look at it from the software AI side, there are different ways how to put the physician into the center in terms of using the software as a decision support system, for example, and then also incentivize the physician to basically look at it as some sort of telemedical services, right? Because once you have the physician gained as your ally, then it's much easier, first of all, to propagate it to patients, and then again, to go back to the insurance companies, to show insurance companies, look, we are saving money because of better downstream treatments which avoid unnecessary costs. So basically, making the physicians part of it, that's important, so that you should not look at it as a standalone technology insulated from the rest of the world. It's very important. Or also in other fields of healthcare, for example, during COVID, point of care was big, isn't it? But point of care, even if you have fast testing, if the logistical process is not fast enough, you have no benefit from a fast test, from a rapid test, because if the logistics takes 2 hours in a hospital system to communicate the test result, there's no value in a 5-minute test.
Thank you very much. Let's hear some more from Dr. Quebec.
Yeah, so, the way clinicians are designed is a little different. We tend to be factual. We work in a certain way. but I want to use innovation, technology, and just trying to think outside our routines for us to provide services back at home. And I'll pick one simple example of bone marrow transplants that we do in our facility at the Nairobi West Hospital. So remember, bone marrow transplants are relatively specialized services. Not every Tom, Dick, and Harry would access these services, and so majority of our patients have had to travel out of the continent, not even out of the country. A lot of times it's out of the continent. I think the closest in the continent may be the southern or the northern part of our continent. And so we thought outside the box, and this is one reason why our facility is trying to take leadership in medical care by applying all the possible mechanisms that are within our jurisdictions. And so we, created a multidisciplinary team. Again, this was just a team that was composed of fellows within. And we had engineers on board, we had various specialists on board, the biomedical team on board, and I happened to have been the team leader to start up this bone marrow transplant program. Just going straight to the issues that we then had to address was that how do we use technology to provide such a sophisticated service in an environment that is less exposed? And so we decided to employ multidisciplinary team approaches and telemedicine with various groups that had exposure and experience as far as bone marrow transplants are concerned. And so we were able to identify clients because, clients were there in plenty. We took information from these groups, discussed with various multidisciplinary groups virtually, sharing information across board. Certain decisions were made. I happen to have had some little exposure during my research work to manage stem cells. So I had the lack of managing stem cells or processing stem cells, in the laboratory. But using newer modalities of stem cell harvesting, I was able to engage companies that were able to provide equipment for us to harvest stem cells. But again, the question was, how then do we proceed in an environment where consultants or specialists who should do bone marrow transplants would assist us? We knew that the role of a doctor is to manage, prescribe, follow up, and we knew that we had this level of expertise. But then the specialized services were not readily available. And we engaged our colleagues across in India. We had other colleagues in the US, but we majorly worked with guys from India to prepare our patients for a local bone marrow transplant program. And trust you me, we were able to prepare patients locally, airlifted this consultant to come and help us with the initial bone marrow transplant. He stuck with us for another 2 days, flew back to India, and used technology to continue supporting our patients. And this far, we've managed to do 2 allogeneic bone marrow transplants and 14 autologous transplants. So technology, in my view, can be used to upgrade services across the world. We don't have to sound, deficient. We don't have to sound desperate. I think we can all work together using technology to make care much more affordable.
That's wonderful. Thank you for that sharing.
Sure. So from my perspective, I think healthcare transformation is on the rise. And I think there's a lot of different changes coming in. And where I think the development going forward is going to be is in digitalization and building and improving technology and how we use that to deliver care. 2 things I'll talk about, which we've seen over the last 2 days, has been the focus of the meeting is AI and how AI is going to impact how you use AI. Are clinicians, doctors, surgeons, physicians going to lose jobs over AI? Which sectors is going to affect? Now, AI is a very good tool, and a lot of people are looking in different industries to use AI for their benefit. And healthcare is the same. We shouldn't really see it as something that is going to start impeding and stopping us doing what we're trying to achieve and do. But I think the status of AI in healthcare has to marry up with the clinician expertise and experience to try and get the best outcome and output from it. So using a lot of data, using a lot of data sets with healthcare scenarios, you need AI to sort of process it quickly. You need AI to be able to give you some sort of a logistic answer, which you cannot on your own. Seeing multiple results, multiple reports across various different specialties coming through to you is very difficult. So AI can do that for you. But what you do with that then for patient benefit, patient care is the key. So you've got to then use that data to streamline and have more patient-specific treatment programs, patient-specific interventions. And at the end of the day, what you're trying to achieve is good outcomes. And for achieving good outcomes, I think you've got to use what's available technology-wise, but you've got to still fall back on clinical expertise and experience. And if you marry both of them up together, I think that's, you're on a winner then. The other thing is predictive modeling or predictive analysis. Now, again, there's a lot of data out there. If you can use that through AI to sort of say certain interventions in certain populations have certain outcomes, again, it empowers patients in making decisions. If they come in to see you and you tell them, right, from all the healthcare status that we've collected, all the investigations we've done, we think if you go ahead with this procedure, this is your risk, which is a lot more than a vague figure that we used to give patients because of the predictive analysis we have now. It empowers them to make a decision, and that's what we're after. So I think AI, predictive analysis, digitalization is probably going to be in the forefront, but you have to work very closely with clinician background, experience, and expertise to deliver that. Thank you.
Thank you very much, and great tools to think about moving forward. What are we doing to move forward? We live in a global world. The world gets smaller. We have the innovation of technology. And what Daniel's creating is our program in multi-languages. Because the human body is the same wherever you come from. And the impact of stress and trauma is the same in different ways, but it comes from holding tension in the body. And so we're currently working with Malawi with their Chichewa language. I went to Malawi in 2018, taught 9 adults. They've reached out to over 6,000 children. They're open-minded. I call them the nation of inspiration. But they're loving it in their language because it makes it education. And let's think, education is key in this world that we live in. We cannot just sit back and do the same old, and think the same old. And the health services in the UK and most likely around the world are drained and strained. We've heard on this stage how care workers, people in caring for others, are not in the best place themselves. Heal thyself, physician. And innovation for us, not just is working with multi-languages, but facilitating online, training facilitators. With the project, so the one thing I have not heard a lot of this 2 days is the children. The children are our next generation. COVID messed them up big time. And we're seeing that everywhere. Children that learn our program, 4-year-olds, 6-year-old recently, his trauma had him wetting himself at school every day, wetting the bed every night, one session that his mum set him up for. No more bedwetting. Wonderful. How many years? Children carry their trauma into their adult life. Let's free up the NHS. Let's free up the carers for the serious diseases and accidents and injuries that need medical attention. But when the majority can free themselves up, have a prescription. That's how I see innovative. Have a prescription, go and do this program for 4 weeks, and come back and see me. You can't talk about the problem if you don't remember what the problem is, because it goes back years. So there's some great innovative opportunities. And when you're online with whatever you do to help people, Even if you're a yoga teacher, you want to talk about nature, online programs reach out to the masses, and that is the joy of technology. So we have to embrace it. It's about education, changing mindsets, and breaking down resistance. Because when we can do that, we'll all be well, we'll all be happy, we'll all sleep, we'll have peace in our heart. Because peace comes from in here. Nobody can help you find it, but we all have the tool to find it. And then the physicians in the surgeries, the hospitals, can progress. Thank you very much. I think we could go on for a long time with this topic.
Sure, we can.
But I've really enjoyed hosting this and listening to the innovation that comes forth. Are there any questions?
Thank you for that. The reason why I came to this particular presentation is I'm involved in a startup with a physiotherapist from Australia and a general practitioner from England. I'm from Australia myself. My name's Clint, by the way. And upon talking to those two, they made a comment that it's a combination of what the health industry attracts in the way of individuals and the way health is taught, which is maybe somewhat counter to being an innovator or something like that. And when I was listening to you, I noticed things like the phrase I think was used to do. Fahad, where you're saying like, people are used to doing it this way, and I heard somebody say the word never. But I did hear efficiency. I also heard the word like we're very fact-based. What are your thoughts on that notion that maybe the way the health education system teaches, but also the kind of people it tries to attract, perhaps not having the disposition towards innovation, and if that is indeed an issue, what are your thoughts on how that can be corrected?
You want me to take that? Thank you very much for the question. So if you just go back a little bit to how all clinicians and doctors and physicians are trained, we're trained to be physicians. We're not trained to be innovators. We go through medical school or any other sort of fraternity. There is never a module which says innovation or what you can do to innovate, or if you have an innovation, that is, what do you do? So this is something that's really not ingrained. So what tends to happen is when you start working and you're busy and you go through your lifestyle clinician-wise, you tend to be on autopilot. You do what you're taught to do, and you do it well because you gain that with experience. But it's only when you start seeing gaps in the place of work, gaps in the service delivery, gaps in what you're trying to achieve, that's when you start thinking, right, how can I do this better? And that's when innovation comes in. And I totally agree with you that at the moment, most healthcare facilities, healthcare practices are not trained and ingrained to get people in who've got ideas, to nurture them, build them, support them, so they can actually reach an end goal. So hence, it becomes almost a solo effort from someone who comes up with an idea to try and push it through. They try and gain some momentum, they gain some interest, they push it through accelerator programs, they say this is a benefit, they get investors on board, and that's when it sees the light of day. But I think it needs to be more centralized. I totally agree with you. I think the concept needs to change, that you need to incorporate innovation, and you need to be looking for innovation in every aspect of your healthcare service delivery. And once you start doing that, you start improving services, you start improving delivery, you start improving products, you start improving implants, you improve global sort of, healthcare services worldwide. And if a lot more people start doing that as they work, and I think, it has a bigger impact. That's my view. I'm not sure if the panel agrees.
I think something has to happen on both sides. For example, now when you talk about AI, generative AI, multi-omics, let's say precision medicine, these are all very new fields, and you cannot expect from a general practitioner, for example, to be a master of all these areas. So basically, then the task is, I think, on the innovator side also to present it in a way that it's really insightful for the clinician and being perceived as valuable. Because if there's a delta in the output, I can have the most precious information, but if I cannot communicate it efficiently to the physician, and no one has to understand in detail how the AI works, because I think most people don't know how a car works, still people buy and drive cars. So, but there needs to be common sense of understanding what it is, and most importantly, what it is good for. And this, I think, needs to be 100% be communicated in the clinician's language.
Sorry, just to add to that, I agree with that, and I think there should be a lot more collaboration between physicians and industry, and also a multidisciplinary type approach. And I think, again, that sense is not there, and I think that sense is lacking, and I think that's something, again, everyone consciously needs to build and develop on. Having an MDT approach, a lot more links to industry, a lot more fast-track programs where you have discussions, where you can share ideas across the board, I think is the way forward.
You took the words out my mouth there, and I was going to say collaboration is important. We all need to work together, because even with the process that we have, it enhances the work that everybody else is doing, and they need that, the nutritionist, the exercise guru, the physio. And then they need to free up and move the next one in, because there are millions of people that need support.
And here the collaboration must happen, I think, on the level of innovator and clinicians, but on the other hand, also internationally, because healthcare is something which impacts the entire humanity, right? And that's the beauty of new methods, that technically they can be globally accessible. And that's also the value I see in this panel and I see in this conference.
Thank you.
And just to add on top of that is because I totally agree with the team here, having this multidisciplinary approach is extremely important. I happen to have been supporting an HIV program in my country, and we noted that as we were, providing services to the HIV patients, it was almost impossible to determine the viral load in the far-flung areas, the unreached areas. And so we had to bring in engineers on board to try and figure out what tool would be sufficient for us as a point of care just to determine the level of viral load. And so working together, I think, in my view, is inevitable. And these silos that we've created possibly need to be done away with so that then we can have a bigger conversation, as professionals.
Thank you very much.
Thank you.
Good morning. My name is Dr. Musa, for who doesn't know me. Thank you again for all the very valuable insights that you guys had. I had one question standing here as a very humble doctor trained as a physician who has particular interest in exactly what you're speaking of, in collaborating and combining the industry sense with, of course, physicians and the medical world. And I'm asking you this as the experts and masters, as innovators and physicians that you are, what were your personal greatest barriers in setting up your own industry kind of companies where you had to overcome them and you had to learn something new as an innovator that you didn't know as a physician? And I know it's a bit personal. Excuse me.
I'd like to start with that one, if I may, because my work's been very challenging. And years ago, I'd stand in front of people and say, you know what, when they first brought yogurt out, nobody wanted to know. We're the new yogurt. And more, we're looking for answers, not go round the same revolving doors. And I would claim to probably have met more resistance, more skepticism than anybody in this room, because everybody does something that is familiar with centuries of building through. But I love the words of Hippocrates, and I use it a lot. The best medicine is to teach people not to need it. And that's what my passion is, that drives me through. And if you have a passion for what you do, and you can prove that it works, then you stand in your shoes because I know what I do is my life purpose, whatever that takes. Because I know something that the majority of people don't know. So whatever the challenge is, if you believe in what you're doing, do it and keep driving forward. That's my message.
Sure, thanks, Dr. Omar, for that question. Whenever anyone starts up with an idea, an innovator, for example, who is a physician, you have a comfort zone of what skill sets you have and what you're comfortable in doing. When you have an idea, you're passionate about it, you have a vision about it. But what I think you've got to realize is you need a team. You need a team who basically buys into your vision, who sees what you are seeing, and they've got the skill set that complements you. So one of the challenges I had when I started off was trying to find that team, the key players in the key positions. You know, it goes to anything you do, right? From sport all the way across to management, leadership. When you've got the right players in the right positions, you will win. And that, I think, is the most challenging thing. And that's what I spent a lot of time doing. Because when you have a vision and you have people coming in, if they don't buy into your vision, they don't see the end goal, which is going to be a few years away. It's not a short-term goal, it's a mid to long-term goal. If they don't see that, it's very difficult for them to buy in and for them to invest into you, invest into your service, invest into what you're trying to achieve. So that's probably the most important thing. The second thing is perseverance, because you will fail. It's difficult, and it will be a struggle to start with, and I've been through that road. And you've got to keep picking yourself up. You've got to keep telling yourself the end goal is what matters. You've got to keep that at sight, and you've got to have people around you who support you, who have your corner, who have your back, so you can actually keep propelling yourself. So those are the two things I think from my side are probably the biggest challenges I faced. Is one is the team, getting the right people, and second is to keep going. You know, when you think, you know, I can't go anymore, you just got to keep pushing, and I think that comes down to what you said as well.
Yeah, I think for me, and again, I'll approach this from a totally different program that I've been supporting for the last 10 years. And this program happens to be a program that supports patients with bleeding disorders. So basically, one of the things that we had to try and do was to demystify, as I said, the boundaries that we tend to, create. And so I started a hybrid program. I call it hybrid, and I still sell that program as such, where I have the clinician, the patient, and the parent together with any other stakeholder working together. Because unless you work together, unless you understand each other, you may not be able to achieve what you want. And just to stretch that a little bit, I realized that a lot of bleeders who have this genetic disorder, and I'll use one of the bleeding disorders called hemophilia, and I'm sure you know that, which tends to affect males more. And I posed this question to my team. Kenya, for example, is a circumcising country. 80% of our males are circumcised. And so the question is, if there is a bleeder, then most likely 80% of these bleeders have gone through a circumciser. And there are two types of circumcisers that I know. You are either going for a traditional process or you are going to a medical specialist for circumcision. So the question was, the medics could pick the bleeder much more easily. What about the traditionalist? Why have we left this traditionalist out? And so we created, a sensitization program for the traditional circumcisers. But for us to do that, we didn't call them traditional circumcisers. We called them traditional surgeons. We changed the designation. And trust you me, we had a hall, the entire hall was packed with the traditional surgeons. And so we communicated to them. We told them the things to look for in bleeders. And trust you me, when we were through with the sessions, we asked them, how many of you may have seen this kind of either patient or family? And we were able to use that information to do a trace back. And we were able to double our number of bleeders, within a very short amount of time. So yes, sometimes we have to be appreciative, even to those that we think are least, because they have the information with you.
And perhaps some last perspectives from my side. What's interesting about healthcare and physicians is it's so complex. So there's a saying in Germany, 2 physicians and 3 opinions. So for example, once I conducted interviews with about 10 different physicians. We asked them about a new technology which we have been developing. And you got the entire range spectrum of opinions, from where can I buy it, that's awesome, to the opinion of no one ever needs that, forget it, right? And everything in between. So the question is, what is right and what represents the majority? And that's so interesting. So basically, you want to talk most likely to a couple of physicians to get a kind of average understanding of what may be a good product or not.
Thank you. We've pushed the boundaries. I know we have, and I'm sure there's a lot of watch tapping going on here. It's a fascinating topic. I thank you all for your time. Do we have time for one more question?
Thanks for bringing this wonderful panel discussion. And I want to just understand that when we are agreeing all on the multidisciplinary approach and on integrative medicine, so my question is that if a modern medicine doctor is having some prescription and on the other side there are some traditional and ancient wisdom is coming in recommendation with some few herbs, how the integration and the contraindication interactiveness of these both pathies has been understood, and is it established that we understand that how, if for one concern one physician is giving one medicine, for example for a cardiac patient, one cardiologist is giving some blood thinner, on the other side in the home remedy the client is taking cinnamon also, so both are blood thinner, do we know the efficiency, interaction and contraindication and how we control it?
Do you want me to take that? So thanks, it's a very good question. Now, when physicians prescribe, they prescribe from an evidence-based, and most of the practice is recommended is from an evidence-based, so what is out there. Now, when you have a multimodality sort of approach where you have, for example, herbal medicine coming in, you've got Ayurvedic medicine coming in, you've got various different sort of medications or natural supplements that the patient is taking, I think the multidisciplinary approach becomes even more important. Because I think what you need to do is you need to sit down with all the stakeholders and you need to sort of come up with a personalized plan for that patient. And that will only happen is when you communicate, when you collaborate, and everyone's on the same page. Because, for example, sometimes in our clinic, we get people coming in, they say, oh, so-and-so has started me on this, so-and-so has started me on this. So if I say, no, stop that, take this, because this is, I think that doesn't work. Because you're creating barriers straight away, and you're alienating your other healthcare professionals. So the best thing to do is say, fine, let's sit down with these healthcare professionals. So you pick up the phone, you have a meeting with them, and you tell them, right, what's your rationale for this? Why have you started this? These are the results and data we've got. We think this works. How can you complement us, or how can we complement you? And when you start thinking in that sort of collaborative sort of format, I think the only one person that benefits is the patient. And that's what you're after. You're after enhancing and empowering the patient. So I think multidisciplinary team approach is probably much more vital now than it has ever been, for that same reasons that you've sort of said, because they come up with different medications, different natural supplements they're on. And the only way to sort of go forward is a joint collaborative approach that can address all of that. And then you will, be able to provide what you want for that patient. And the patient, again, is important because there are certain beliefs, certain preconceptions that they come with. So you cannot discard them. You have to take them on board, and you have to build your treatment plans, your programs, your personalized approach using that facet, because that has a psychological impact on the patient. They know, right, the doctor or the consultant who I'm seeing is taking this on board, which is important to me, not just discarding it. And that helps itself in, improving their outcome, improving their care delivery, them coming back to see you. And if they know everyone that I'm involved with is part of a team that's providing care for me, it's easier for them to sort of, take that on board.
And I think just to add on top of what he has said, because I totally agree with him, I think as doctors, we need to get away from this nice bubble that we've put ourselves in, where you are the know-it-all and whatever you say, is the ultimate, and try to be accommodative, because culturally we have different practices. People are doing all sorts of things. We should stop being judgmental, because I think that is where we lose it all. We become so judgmental that the patient then doesn't give you sufficient information to make certain decisions. And I actually have a patient right now who has been on different combinations of drugs, and we only realized that this patient was on different combinations other than our usual conventional medicines. He's a diabetic when he went into coma. So, and apparently we had to pull out everything only to realize that this patient did not even need medication. So, yeah, we all have to be accommodative and try to talk to each other as much as possible. Otherwise, there are no rights or wrongs, in this current, should I say, time.
And just very quickly, we have doctors, psychotherapists, therapists, counsellors that work with us. They are able to support their patients as they heal on different levels. But that's something I'm very happy to discuss further, because we offer facilitator training as well to do it in-house. So I hope that helps and
yes.
answers your question.
Happy to hear you all, and I would like to add that along with the collaboration and setting the right set of communication, so I will suggest that we should document also the interdisciplinary medicine interactions, and so that we can all go away with more precision. Yeah,
I agree. Thank you.
yeah. Thank you. Thanks.
I don't have a question, but I have a kind of a confession to make. As I was sitting there, I was cringing in pain. While I'm enjoying what you're saying, I'm saying, what an act to follow. I'm doing the keynote next. And I was agonizing, how in the world do I have a fraction of the amazing content and presentation you all had? So thank you. But not being a negative person, I went the positive way. And I said, here's Dr. Carolyn Purvey saying the value of yoga and holistic cleansing to help our bodies clean themselves and be better people. And that's crux of what I wanted to talk about in my keynote. And here we have Dr. Kibet mentioning medical fraud, which is such a pain in our lives. The most honorable profession. I grew up as a child worshiping doctors as God, teachers as God, and sadly both the professions are corrupt today. And you talked about collaboration between physicians and industry globally, multidiscipline. That is so valuable. Thank you for that. And finally, you said the best medicine is to teach people not to need it. Prevention is better than cure. Thank you for your wisdom. I think everyone here, I speak on behalf of everyone, we are extremely grateful for everything you taught us. Thank you.
Thank you
Thank
so
you very
much.
much. Thanks.
And ladies and gents, let today be the first day of the next day. Innovate, talk to each other, find out what's possible, because I truly believe the impossible is possible. Thank you for your attention. Thank you, gentlemen.
Thank you, everyone.
Thank
Thanks
you.
very much.